Well, I'm O.P.Yadava. I'm the Chief Cardiac Surgeon and the Chief Executive Officer of the National Heart Institute in New Delhi. This is not a straightforward, simple question because the decision to operate or not to operate is based on multiple factors which take into account the patient's symptoms, the coronary anatomy, the type and the degree of blockage. We also look into whether the financial status of the patient is adequate to afford a surgery and what is his psychological makeup, including his personal preferences. In generic terms, if the coronary blockages are mild to moderate, or if the patient is totally asymptomatic or has stable symptoms and he doesn't have critical coronary lesions, something like critical left main stenosis or a proximal LAD or severe LV dysfunction, then these patients can be managed adequately with medical therapy. Also, if the patient has disease which is suitable for angioplasty, then I think today the angioplasty has evolved to an extent that it may be in some patients a preferable option to bypass surgery.